Hello everyone, welcome to Azanoa podcast where we keep things real. Okay, today we're going to talk about health, how everyday people go through life, the challenges they face, some life learning, particularly those suffering from cancer. So that's the topic for today, how Mr. Evans, after his surgery with prostate cancer, he will be talking about his journey and how he overcome and the challenges having survived with prostate cancer. Hello everyone. Today my guest is Mr. Jeff Evans, a friend of mine, and he's volunteered to come and speak to us about surviving prostate cancer. Am I right? Welcome to my podcast, Jeff. Tell me.
Thanks, Azza. Yeah, of course, Azza and I have known one another for a very long time.
Yeah, that's a very long time.
And, and so much so that he always refers to me by age. You know, it so happens in our little group of 4 or 5 people who know one another for more than 30 years, I happen to be the eldest.
Yeah, he's the elder, much older.
Yeah. But
he doesn't look it though.
Whatever he does, I don't like to be defined by age. For that matter, I don't like to be defined by anything really. Definitely not color or race or creed or religion. Most definitely not religion. But yeah, I mean, we have to accept the fact that we all get older as the days go by. And in my case, I've never had any issues with health. Never.
You've always been healthy.
Always healthy.
I've known you a marathon. You're always
Absolutely. Running, swimming, whatever, sailing.
Everything, yeah.
All my sports are pretty outdoor and pretty active, and they still are.
Yeah.
I remember my father once, he said to me, he said, you know, when you get older, you don't feel older.
Mm-hmm.
But what happens is that you notice that there are certain things that you can't do anymore, which you could do before. Mm-hmm. So I suppose, you know, inevitably, I'm in my 70s now, age does catch up.
All right.
But
early 70s, huh?
I'm 73.
Okay.
But what really happened that became much more of an issue, I suppose, related to age, but certainly related to health, was that I started to have some issues with my prostate.
Okay.
And you kind of know that definitely in Western societies. I live in Australia, although I'm British. You definitely know that because you are encouraged to have annual tests, blood tests, and it's called.
How often do you do that?
Well, normally, someone 60 plus would be having them annually.
Annually, okay.
Yeah, and it's called the PSA test, which stands for prostate specific antigen test. Okay. It's a blood test, nothing more. They take blood, they test it, and they look at your level. It's a bit like diabetes.
All right.
You know, whether you've got diabetes, the number's higher. You've got diabetes, the number's lower. You haven't. So with the prostate, you shouldn't be above the level 5 or 5.5. When it starts to increase from there, then there are some concerns that you might have developed prostate cancer. Now, before any of your Asian listeners get too worried about this, if they might, prostate cancer is more prevalent. It doesn't mean it's exclusive, but it's more prevalent in Caucasians than in Asians.
Oh, lucky for us.
Lucky for you. However, there are certain diseases which are much more prevalent amongst Asians.
Yeah, true. Like colon cancer and so
no, it's diabetes is one, and heart disease is another. And of course, that's very much related to diet and lifestyle, and especially now that so many Asians, especially middle class and above, are no longer working in the gardens or working on the roads or working in factories, and instead they're spending their time watching TV or playing with their phones or computers. So the risks of those kinds of diseases become more. Anyway, back to prostate cancer. Yeah. So my PSA started to rise.
When?
Actually, long ago. I mean, I was still pretty young.
Every year
at that time.
You take that test every year.
Or what happened in my case was, as you know, I've worked overseas most of my life, and I happened to be working in Pakistan. I think it may have been about 2000 and 14, 15, around 10 years ago.
All right.
And I developed a fever. And I went in to see the doctor because it was pretty bad.
Okay.
And whatever tests were done, it turned out that my PSA level was sky high. We're not talking about level 5, we're talking about level 25.
My
it was
gosh.
extremely high.
Yeah.
But of course, the PSA, which is an indicator of cancer, it's not exclusively an indicator of cancer. It's been exclusive of some other malfunction of the prostate.
All right.
And in my case, it was that I had an infection of the prostate. Lord alone knows how I managed to get that, but I got this infection. And once I was treated for it, the PSA level went back down again, but it never dropped to normal levels. Normal being 5, 4, 3, 2, 1.
Okay, right.
Instead, it was 8, 9, even going up to 10. So after that, I was put under a specialist in Australia, and the specialist checked me every year.
Just what's the symptoms? What the indication that?
None. Absolutely zero.
You don't know. You don't feel anything.
No, any more than if you've got lung cancer or you've got, in a woman, breast cancer.
Nothing.
You have no symptoms whatsoever. There are ways that you know that things are not right, which doesn't necessarily mean cancer. As men age, and that would apply to Asians as well as to Caucasians, the prostate grows in size. I should explain. The prostate is a walnut-sized gland that exists below the bladder and before the penis, and it is around the urethra. The urethra is the tube that carries urine. From the bladder out through the penis. Sorry if I'm upsetting anybody, but these are all technical terms and I have to come up with them.
As long as it's technical, it's fine.
Yeah, and what happens is as the prostate grows, it not only grows outwards, but it grows inwards, and it grips the urethra. So it makes your flow of urine slower. And highly unlikely that even you, Azza, would have a flow of urine which is as fast as it was.
Yeah, true. As you get older, I noticed that. Yeah.
Because the prostate is restricting the flow of urine.
All right.
So that's the only symptom. But having an enlarged prostate doesn't mean that you've got prostate cancer.
Okay.
It means you've got an enlarged prostate.
Oh.
And
infection of some sort.
No, it's simply, just as
growing,
many people, your heart gets bigger with age, your prostate can also get bigger. It's not related to anything that you've done in your life or anything that you can control. It just happens.
So you're lucky that you had high fever that one time.
Well, I suppose it was an indicator, but I mean, I think, and I would advise anybody, including anybody here in Malaysia, but it doesn't necessarily mean because you're Caucasian you should have it done more often, that you should have an annual checkup. One of the things that you should have done in that checkup is your PSA level.
PSA level, yeah.
And if it starts to rise, then you will be referred by your general practitioner to a specialist who is a urologist. Urologists are people that deal with.
So do you believe early detection is very good?
Early detection is the only way that you can actually stop the cancer becoming a huge problem in your life and can lead to death. I mean, that's what cancer does.
Right.
But it's often said that people die with prostate cancer rather than dying from prostate cancer. It's often said. Because as long as the cancer, the tumor, is held within the prostate, it's unlikely that it's going to do any damage. The problem comes when the prostate spreads from the prostate into other organs.
Okay.
And typically that would be the kidneys, because they're also, or it could be the liver, or it could be the stomach.
Okay.
In other words, the organs that surround the prostate could also become infected.
That's how cancer works, right?
That's how cancer works. Yeah. And those are the cancers which would then kill you rather than the prostate cancer itself. Because if you don't have a liver, you're not going to survive. Right. If you don't have kidneys, you're going to be on dialysis, you're going to be dead. I mean, these are the things that happen. So it gets into the bloodstream, all sorts of things can happen. So that's why you're advised to have regular tests. And
it doesn't cost that much, right? Just to do a quick test?
Well, in Australia, because it's covered under Medicare, it doesn't cost anything. But no, you're talking about a few dollars. It's not a big deal.
All right.
So eventually, and I say over a 10-year period, my prostate was monitored in a system that they call active surveillance. Now you take your prostate level, your PSA level, and monitor it, and it never really varied much. It went up, it went down, it went up, it went down, but it never really got anywhere where the urologist was concerned that it might be something else. And then it started to, about a year ago, to go up more abnormally than it was already.
Oh, okay.
And we reached...
Did you have any treatment when they identified?
No, there's no treatment whatsoever.
Medication and stuff?
No medication whatsoever.
Okay.
The only medication they can give you is for the size of the prostate. In other words, if you're having trouble passing urine, they can give you a tablet called tamsulosin, which will probably make it easier for you to pee.
All right.
But that's nothing to do with cancer.
Do you pee more often, or is it just more difficult to pee?
Yes, but that is again not a symptom of the cancer. Yeah. That's a symptom of the enlarged prostate.
Okay,
it's not anything to do with that. So then, of course, if they think, God, this PSA is going up a bit much, we should do something, they send you for an MRI.
Okay.
And the MRI, if you like, takes scans or pictures of your prostate, and that's where they picked up that there was a tumor. Initially, they said it's very small. We don't. But we think we should send you for biopsies.
You're right.
Biopsies where they take little samples from your prostate. It's not going to how they do it, but they do it, and then they analyze them to see whether or not you got cancer.
It's malignant or not. Yeah.
Oh, it's malignant. And in my case, it was, and the way that they measure malignancy is to give you what is called a Gleason score. Gleason is the name of the guy who invented this, I suppose.
Oh, okay.
So if the score is less than 6, it's not cancer. Oh. If it's 6, 7, 8, 9, or 10, it reflects the level of severity or seriousness that the cancer has in you. And in my case, it got to level 7. At that stage, the urologist said, look, Jeff, you've been nursing this for the last 10 years. We've been monitoring active surveillance. I think now, we better do something.
Yeah. But you never felt all this time nothing.
Nothing.
Just normal.
No, nothing. Normal other than the issues of an enlarged prostate.
Okay, you didn't feel tired or...
No, nothing.
No, okay.
No, I mean, you've known me. You've seen me all the time. I don't have any problems. And nor did I, when I was told, apart from feeling emotionally upset, nor did I feel that there was anything else wrong with me because I didn't have any symptoms.
Yep.
That was the case when I last saw you in Australia in March. That was the situation.
Okay.
But I knew then that probably something would have to be done because I didn't want that cancer to spread beyond the level. And this was the advice that I was getting. I didn't want it to go to other organs. So I was then asked, what are the options that I have? Well, he said, it's not very high at 7. You can leave it. And I hope it doesn't get any worse. I said, yeah, but you're saying that I should do something. And he said, yeah, I think, if I was in your position, and then you're thinking, well, here's a surgeon, he's also making money from doing operations.
Yeah,
what you have to make these kind of judgments.
Yeah, sometimes you have a second opinion, is always better.
And he also said, you can go for a second opinion.
Yeah.
I said, look, you first tell me what are the other options. Yeah. So he said, you can have radiation treatment. Now, radiation treatment, we all do some Google research. Radiation treatment means that they give you some hormone treatment to shrink the size of the tumor. And then when it's shrunk to a smaller size, they can target it by targeted radiation.
Okay.
And radiation is effectively burning.
Right.
It burns the tumor off. And the bigger the area they have to burn, the more likely it is that the radiation could affect other parts of your body.
Right.
Which is not good, right? It's not good to be burning this, that, and the other in your body.
Yeah.
So that's why they give you the hormone treatment. The hormone treatment also has side effects. It reduces testosterone levels. It can lead to weight increase. There are many things. And so that was one option. Leave it or have radiation treatment, or you can have a prostatectomy. Prostatectomy means remove it. Take the prostate from your body. Well, can you live without a prostate?
Right.
And the answer is yes, the prostate has functions, but it's a bit like having your appendix out. You can live without an appendix, just as easily you can live with it. And you can live without a prostate. It doesn't mean that there aren't other side effects.
Right.
So
the side effect is your concern.
The side effects are definitely my concern. One of the inevitable side effects is your ability to retain urine. In other words, that you're not bluntly going to be pissing yourself.
Right.
And these things are generally temporary, but it can be very embarrassing because what the prostate does is to enable you to restrict and open the urethra at the right times. That's one of its functions.
The contraction of the muscle.
So yes, it's actually a sphincter. It's a sphincter that opens and closes. When you have the prostate removed, then that lower sphincter doesn't operate anymore, the one that's just below the bladder.
I understand.
So then you have to go through a lot of physiotherapy treatment in order to enable you to become back to being continent as opposed to incontinent.
But you have time before to rush to the toilet, right?
What you have to do is you have to train other muscles to take the place of the ones that have been removed by the removal of the prostate to restore your continence. And that's a process that I've been going through and continue to do exercises for that purpose. It's not difficult to do the exercises. It only takes 10 minutes a day to do them.
Has it helped?
Absolutely. I mean, I'm definitely able to.
You feel like having a peak? You need 5 minutes?
I had the operation done 3 months ago, and I would say now I'm completely dry. But if I feel that I want to go to the toilet, I want to go. I'm not going to be waiting for another have a couple of beers before I go off there.
Okay.
Right. So that's one, and the other one, of course, is sexual function.
Right. Yeah.
And of course, you.
That is the most important part.
You, being you, might say, "Oh well, it doesn't matter to you. You've reached the age; it doesn't make any difference." Yeah. But of course, I mean, there's two aspects to that. One is that
can you still do it?
Yeah. One is that no matter what age you are, I think a lot of people in their 70s, 80s, even 90s are still sexually active.
Oh, okay.
But the other
I've
thing
never reached there, so I don't know.
No, but after all, you're in your 60s, and I believe that you have been known to be sexually active. During that time.
I don't know, 70s.
Whereas if you were to ask a 20 or 30-year-old, they say, well, that old person doesn't need to bother because they're beyond it anyway.
Well, they're totally wrong.
But the other fact is that there is that within you there is, if you like, an emotion. It's something to do with manhood.
Right.
That if you lose the ability to have sex, you can no longer physically do it. That you feel you have lost your manliness.
True, manhood.
I mean, I could perhaps explain it to a woman in terms of, if you have your uterus removed, and you lose the ability to have babies, or you have breast removed because you've got breast cancer. By the way, the prostate cancer is the most common form of prostate cancer in a man, and breast cancer is the most common form of cancer in a woman. So I'm sure emotionally, you go through the same kind of feelings.
I'm sure.
In that process. So these were the things I had to weigh up.
Yeah.
Was I going for radiation? I said, look, without...
It's life and death, right, you see?
Not life and death at that stage. And as he said, you can leave it because it's not very bad. The cancer's not got to a 8, 9, 10 level. It's only at 7.
All right.
But if it's beginning to move, the chances are upwards that it's going to be...
risky.
And if you leave it too long, and it has exited from your prostate into your bloodstream, into whatever, then you're in a big battle, to save your life. And these days, a lot can be done to deal with cancer, and a lot can be done even if you've got stage 4 lung cancer. A lot can be done.
Okay.
But it doesn't mean that you're not going to have a bloody miserable time going through that process of making yourself whole again, even if you succeed, which you may not. It may be too late.
Right.
Gets in the lymph glands and all sorts of things. I mean, for me, it was a big thing because never been sick, never been ill, always been active, both sexually and physically, and thinking, is this the end of life? And it's quite a big
decision to make.
Big decision to make.
Yeah.
And I decided,
especially your manhood, I'm sure.
No, not especially, but I mean that was certainly there, in the upper part of my brain, not in my prostate. So I took the decision, one, that I wasn't going to seek a second opinion. I'd been with this guy for years.
Okay. Yeah.
I kind of trusted him.
Yeah, that's good.
I'd done all the Googling. He'd got a very good reputation in terms of the reviews that he'd had from other people. And I thought, no, let me... So I chose the person. The other thing was that when you have the operation done, it can be done manually, which is basically that they cut you open in the stomach and go in and the lower part of your abdomen, and they're going to take it out. And the other is that you can have keyhole surgery, where a much smaller incision is made, and they.
That's a new technology, I heard.
A new technology, but more than that, that the keyhole surgery can be done by someone manipulating forceps, or it can be done with the help of a robot.
Okay.
So robotic keyhole surgery was something that this particular urologist did. And he's a man in his probably late 40s. So he was young enough to be keeping up with So I decided on him, and I decided on surgery rather than the radiation treatment or leaving it. I didn't want to go through some nasty side effects.
You're talking about the keyhole surgery went on with
keyhole and robotic.
And
robotic. So that was my decision. I later found out that, of course, robotic surgery is quite a bit more expensive than normal. I'm quite sure they do it here in Malaysia. I'm quite sure that the government hospitals as well as the private hospitals will do it. You'd have to check out. I mean, should you be unfortunate enough to be in that position? So I decided to go through that process, and actually, the only thing I didn't expect was that the surgery is relatively major, and I'm thinking you've got a small walnut-sized gland inside of you. How much you can have operations done where you have much bigger surgery, much bigger organs are being dealt with, and you can get over it quite quickly. But this actually does take quite a long time to get over. That I didn't expect. And in my case, there were a few complications which made it even longer. Was it painful? Well, it's painful if you're cut open in the abdomen. It's painful because the stitches have to repair and all that. But that wasn't the key issue. For me, the key issue was that the prostate had become quite large. Nothing to do with the cancer, but it had become quite enlarged. And it was pushing up against the bladder. So when he used the robot to cut it out, it damaged the point at which the urethra connects to the bladder. It had to be repaired. And in that process, the bladder actually blocked. So not only had I gone through the prostate operation, but subsequently I had a blockage. That was probably the worst thing, the worst day of my life. I'm out, I'm over the operation, I'm working with a friend in the garden, hanging a new gate in Perth with Greg, who you've met. And I suddenly thought, my God, you got up this morning and you haven't had a pee since then. Never mind about...
That's unusual.
By now it's getting to lunchtime.
Okay.
So I was getting... And I was feeling very uncomfortable. So I asked my friend Greg, can you... what am I going to do? And he said, well, you better take you to the emergency department. Emergency departments in Australia are very overworked. It's probably like going to a GH emergency department here, and you don't have that privilege of demanding attention straight away. You have to go to triage nurses and await your turn, and I thought, this is terrible. So I called the offices of this surgeon who'd done the job. He's a private surgeon, he's not a government surgeon. And so happened that he was mercifully operating that day in a private hospital. The message was got to him in the operating theatre. He said, oh, you better come straight away. So I'm taken by Greg to the hospital, and by now it's about 2:00 in the afternoon, and I haven't had a piss since early morning. It was a bit serious. And I had to be admitted, which was a long process because they didn't have all the paperwork. I was just standing there saying I need attention. And by about 4:00, I always remember, I'm taken to a ward and put in, and the nurse comes up and she says, we're ready to take you down. The doctor's ready, surgeon's ready for you now. just go and go to the toilet and empty your bladder. Right? I said, the reason I'm here is I cannot empty my bladder.
because the veins
the joint from the urethra to the bladder had been blocked.
Okay.
Had
blocked. All right.
Not bursted, blocked.
It must be painful.
By then it was painful.
Okay.
Yeah, it was painful. So I had to go down and he puts a catheter in through your penis. There's no other. Sorry, there's no other way to have it done.
Did they give you anything for it?
Well, he couldn't give me the normal general anesthetic because I had eaten. Normally you have to fast for 12 hours before you have that anesthetic. You've been through this kind of surgery. Yeah. So I had to have it done without. There was a deadening injection. He said, Jeff, I can show you on the camera what's going on. I said, please don't. On the screen, I'd rather not.
Heart is the same. You can see your heart.
Just get it sorted out, man.
Yeah. Well, I still remember having a catheter up my penis. I said, God, it's very painful. I don't want to go through that again.
Yeah, well, yeah. I had to go through that, and then I had to go back later when I could go on a general anesthetic. I was in hospital for another week, and they did more, shall we say, reconstructive work. So I had a tougher time than most. Normally, the prostate's out, the surgery's done, and you just get on with your recovery process.
So tell me about the recovery. I understand that's the crucial part because...
Okay, well, the two problems, one your sexual function, which we'll talk about a little bit, I suppose, and the other one was to do with continence and your inability to hold urine. So you have to develop muscles that are called your pelvic floor muscles. And these are the ones that are not at the bladder end, but rather at the top of the penis end. And you have to use your lower abdominal or pelvic muscles to be able to grip your urethra, which is where the urine passes through. And for that I went to a physiotherapist, and the physiotherapists give you all kinds of exercises to do, which I still have to do. I still have to do on a regular basis. And in the meantime, you are in that embarrassing position of going back to babyhood and having to wear pads. Like a kid, like a kid wearing nappies. Wearing a diaper. Well, not exactly diapers, but continence pads.
All right.
And I suppose because of the issues that I had, that took longer than normal.
I see. So they give you a bag so that you can pee?
No, it's not a bag. Well, if you have a catheter, you have a bag.
Okay, right.
But once the catheter's out, then it's a case of can you hold your urine before you get to the toilet. That's why and I probably wore pads for 4 weeks.
Okay.
Very unpleasant and demeaning, psychologically.
Yep. You look like a big baby.
You feel like that. You feel like, no, I'm not. I'm not exactly wandering around with nappies, but so happens that I've got a granddaughter quite recently, first grandchild. And and we are she's having one
Beautiful
nappy change,
girl,
and I'm having another nappy change at the same time. So it's quite interesting. Anyway, so that was dealt with eventually, and then I was referred by the surgeon. He said, "Look, if you're still actively, active in sex, you might want to see a nurse practitioner that I deal with."
Really
they
serious?
give these terms.
A woman.
A very good-looking woman at that.
Okay.
But in this stage, it's not going to help you a great deal.
Yeah, right. It's not. Nothing's going to happen anyway.
Yeah. So at this stage, I should explain that men may be defined by, or they may define themselves by the size of their penis and the strength of their erections and all the rest of it.
Okay.
But actually, it's a mechanical process.
All right.
And it's that mechanical process that you have to learn about and understand. It's not simply that you're about to have sex and you get an erection. There is a process that's involved. And the prostate
normally that's the
has a. It's almost like the vines of a grape tree.
Okay.
Or grape bush. They're growing around the prostate.
All right.
And they are the ones that when sex is on the cards, they send or some form of sexual activity. It doesn't have to be sex, of course. They send a message to the brain, and the brain then says, okay, release this chemical, and a chemical is released which is in fact nitrous oxide. And you as a chemist will know that
laughing gas, is it?
It's laughing gas.
Okay, fine.
But it doesn't make you laugh, it makes you have an erection. I mean, that's the point of it.
All right.
So these nerves are essential for this purpose. So when the surgery was done, the urologist, and I'm sure he would do it for all people, if he's able to, it depends where the cancer is, but if he's able to, he will spare the nerves, as it's called, nerve-sparing surgery.
Okay.
So he spared the nerves, and in my case, I was then in a position where the prostate removed, the vines had nothing had nothing to cling to,
right.
So they fall in a heap either side. But there's nothing for them to go around. Put it that way.
Understood.
And the process of those nerves recovering, which I have yet to find out whether they will, could be, if you're lucky, 1 month. It could be 6 months. It could be 1 year.
So there is hope.
In that case,
under normal circumstances, it's there's no hope. Right?
No doctor is going to say there's no hope.
Okay.
You know. But no, I believe, and I have listened, believe me, to enough podcasts.
All right.
Because this particular nurse practitioner, this lady that I saw, she makes a regular podcast of people that who've had this. She interviews all kinds of people, just like you're interviewing me.
Okay.
She's not interviewing me, but I could be one of them.
Right.
And in most cases, yes. In most cases, it seems that this function comes back,
and it helps.
It doesn't just help. She has helped, but whether or not
she doesn't actually help, but
she's not personally egging you on.
All right.
But she's in a professional way. She's giving you all the best advice and indeed supports.
All right.
But one thing that and now here, I'm sorry, I'm not upsetting anybody, but I have to explain this, otherwise.
Please do. As long as he's technical.
Yeah. You must understand that you've got the bladder, and then you've got the prostate, and then you've got the penis.
All right.
And the urethra goes through from the bladder through the prostate to the penis. If you take out the walnut, the ping pong ball, whatever it may be, then there's nothing but this bunch of loose nerves that are around, and if you don't do anything, it's not going to affect your life. If you don't have physiotherapy, you won't be continent. But if you don't do other things, which I'm now doing, then you may find that because you've lost this intermediary organ, that your penis will be absorbed back into the body.
Absorbed back.
Okay. Correct. So you could end up with a
smaller penis.
With a shorter dick.
Okay.
Yeah, is maybe the way to put it.
Okay.
So
so you're going through this therapy. So there is hope, and for men.
The therapy is to perform exercises and have some chemical interventions, which immediately enable you to have erections again.
Not Viagra or something.
Viagra is not going to work.
Okay.
Viagra is simply, as you know, Viagra, or more like these days they don't use Viagra, they use tadalafil, which is is a drug which you can buy.
We're not promoting anything here. Okay.
No. The tadalafil is the generic term. It's not. Okay. It's not. It's Cialis is what everybody knows it as.
Okay.
As
that's
a
brand. Yeah.
But they make other brands of it as well. And what that does is, these were both drugs that were designed for heart problems. Because what they do is they dilate the blood vessels.
Okay.
And the only thing that's a difference between a limp dick and a standing dick, the only thing that's different is the amount of blood which is in that organ.
Through. Yeah.
So the bigger your capillaries, the bigger your blood vessels, then the more likely you are to be standing proud.
Okay.
In a male sense.
Right.
And that's exactly what happens when these nerves that you have are receiving the message, the nitrous oxide, the valves open, and the blood flows in. At that point, then the process is that the gates are closed. A bit like opening the floodgates on a dam and then closing it. So then your organ, your sexual organ, is filled with blood. It's standing in a way which is then capable of having sex with a woman. Or
so what if
in this case, you can have erections either by using a vacuum system, which effectively sucks blood by creating a vacuum.
So there is a vacuum machine.
A mechanical machine.
All right. Okay.
And they go under different brand names, but that's all been helped and explained.
So you use this every day to exercise.
But the reason for using it is not to give you erections. It's to stop the possibility of the penis being reabsorbed back into the or becoming shorter. If you want to put it that way.
Yeah.
The other is a chemical intervention which replaces what was being done with nitrous oxide. And they're not going to fill you with nitrous oxide. And I'm not a chemist, and I can't tell you exactly what the compounds are. But in effect, you inject yourself. But that sounds terrible because you have to inject yourself in the penis. Okay. And you might think, my God, I'm never going to be able to do that.
Right.
And that's exactly what I thought. My God, I'm never going to be able to do that. But in fact, it's a bit like you're taking a blood test to see whether you've got sugar level diabetes. It's the same kind of, sorry, I have to use the term prick.
Yeah.
It's the same kind of prick that you,
Okay.
and then that puts the chemicals in which perform all the functions which otherwise the nerves would perform. Those nerves which are...
And you're undergoing this now? This is...
Yeah, I have them. I have them.
Right.
And I can do it. And then in
it takes time? 1 or 2 years?
10 minutes. Or
okay, no, I mean, this rehab will take time?
Well, that depends on your luck, I suppose.
I mean, if it's a beautiful woman pass by, I mean, do you feel anything?
You might feel a lot of things, but the ability to do anything about it is what we're talking about.
But you do feel.
Remember what my father said, it doesn't take away the desire, but it detracts from the performance.
Okay.
Imagine that you'd had 20 glasses of beer, and then you see a beautiful girl walking by. Nothing might happen.
Okay.
Because all you want to do is to go and sleep.
You're right.
So, these chemicals or the vacuum system replace what effectively has been done by your body, and now this is a supplement, and the reasons for doing it are rehabilitation rather than sex. But it doesn't mean that you can't use them for sex if that's what you want to do. Now, whether this happens or not does depend on your luck, to an extent your age, and to an extent your willingness to persevere. I mean, I know people who've had prostate, and they say it's the end, and I'm not going to do anything more about it, and that's the end of it. Well, I mean, so be it. I personally, have never been like that.
So the nurse is quite confident that a lot of people recovers from it?
Well, it's a medical known fact that many people do. I can't give you percentages. But rehabilitation can enable you to. So, to all intents and purposes, I'm back to normal.
Wow.
I'm swimming, I'm fishing, I'm sailing.
Right. That's most important.
I'm gymming. I'm doing all the things that I did before.
Right.
I'm willing to talk about it,
No.
which is not
Thank you.
something the easiest thing to do when it happens to be my body. But these are things which anybody can read on Google.
The whole purpose is to make us men aware of this problem.
Well, and women as well, of course, because in my case, I'm married. You have a partner; they also have to understand.
Okay.
What's
it's also both ways. Your partner must understand your situation.
I mean, imagine that you are a man and you have a partner. Let's not say wife, but you have a female partner who has breast cancer and breast removed. You have to accept it in some way or the other.
And give support.
And give support because she doesn't need support any longer. No, sorry, that was an uncalled for joke.
Anyway, I go sailing with Jeff. He's a sailor.
It doesn't mean that I'm crude.
Anyway, tell me, that was interesting again, especially for those men, especially. Hopefully they can...
Look, if I've got a message, it's...
Right, I just wanted to say, do you want to give a message
I don't care whether you're black, white or green. I don't care whether you're Asian or Caucasian or African or whatever you may be.
Right.
Don't think that you are ever excluded from the possibility of having. And I would say anybody who has reached upper 50s should be having a thorough medical checkup, including PSA, at least once a year. And don't think, I don't have any symptoms, I got nothing wrong with me. Don't think it.
Yeah.
Because you'll never know. Any more than you know when you're going to get a heart attack or a stroke. You better have these tests done.
No one is immune. Yeah.
No one's immune.
No one's immune, and I think it's a good advice. Once a year, no harm done, and you can prevent it. If it's too late, then it can be life and death. Am I correct?
Well, absolutely. I mean, cancer kills. Cancer's a killer. Yeah, it sure is. Yeah.
Anyway, I think that concludes our time and very interesting topic, and I hope we've learned something out of this and some value to you all. I normally finish with a question for my friend. Jeff, he travels around the world, and I know you've lived around the world. What is it like being exposed to many culture and race, and having to live in different habitats and having to blend in? What's your opinion on that?
Well, yeah, I think I've lived and worked in 12 countries. So traveling to a country and living in a country are completely different things. Now, sometimes I hear of people I visited over 100 countries, but that's not the same as being part of the culture, or at least being immersed in the culture of a country. The culture being the food, the religion, the people, the whatever. And to me, that I would say it's a huge privilege that I've had. And I have learned a great deal. I have learned a great deal, far more than I have ever taught. And I have been a teacher as well, as you know. So I would say that it's given me the opportunity to understand better what the world means and what people in the world want and what they expect. And the privilege that I've had is far greater than I've ever contributed to any society. I mean, mostly the jobs I was doing was trying to help, poorer people in the societies that I've lived in. But I've gained far more than I have delivered, for sure. And I don't look at anybody, and I can honestly say this is the case, I don't look at anybody with they're from Africa, or they're from Asia,
religion, or race.
No, yeah? Unless somebody chooses to be bigoted, in my opinion, about their religious beliefs, I will let sleeping dogs lie.
Right.
I don't happen to be religious, but that's not the issue. But I don't want to be dictated to, and nor do I want to dictate.
Do you feel that we are all equal?
Absolutely. I feel we're all equal. We're not all as privileged as one another. Right. That's a different matter.
Right.
But equal, yes. I mean, we're all inconsequential humans living in this earth, which, by the way, we are slowly draining away its ability to continue. Environmentalism and climate change and all the rest of it. But that's not the topic for today.
Right.
But no, for me, I have gained far more than I have given. And I feel privileged to do so, and I make no judgment on a person by his sex or colour or creed or race or anything else. And that, to me, is what I've gained by living in, having the privilege to live in many different countries around the world.
But that's why you're exposed to all travel and people around the world. That makes what you are today, right?
I hope. I hope it makes me privileged. Whether it makes me better is not for me to judge.
All right. All right. After going through all this, and I'm sure it's made an impact on you with your life. What is it next? What is it that you've learned and you want to move on in life? What is you have a purpose? You have a goal that you want to achieve?
Well, I want to remain healthy. Especially given the scare that I've had. And I want to remain happy, and that's happy in a family life and happy with friends and happy in the occupations.
Sailing.
Well, whatever hobbies.
It's crazy about sailing.
Sailing and fishing happen to be things that I do. I mean, the reason I'm here in Malaysia is because I'm going fishing tomorrow. But that's what I want to carry on. But the fact is, Shakespeare said you're put on this world for 70 years and 10. 70 years and 10 is 70 years. I've exceeded that.
Oh, okay.
But I want to be here for a few years more,
Right.
as long as I remain healthy.
Right.
If you're not healthy, better don't be
And
here.
you will continue to maintain that, right? That is your
Yes.
ulterior
that is
motive.
my intention to do so. But I accept the reality. We all die. But what I don't want is to die unhealthy.
Right.
I'd rather die healthy.
Right.
And I'm sure we all feel the same.
Yes, I think that is most people. So some people forget health is important.
More important than anything.
They're chasing the money and they forget about health.
More important than anything.
Yeah,
yes.
that's the sad part, that
and-
people
and,
forget
it's
what is
very
important.
It's very
in
hard
life.
to give up a career. It's very hard to give up that money chase. It's very
Right.
hard.
And
It's
you
very
know-
hard to know.
You've been through that, right?
Yeah, for sure. I've been
And
through that.
and looking back, your health is more important than your career. Yeah.
Yeah, I mean, I didn't have to give up one for the other. My career was not affected by my health, but
Okay.
but yes, health is definitely. And I think when you're making the decision about when to retire and enjoy your life, whatever enjoyment may be. Some people, unfortunately, don't seem to be able to do that.
Yeah.
They give up the job and they wonder what they're going to do. Do the crossword in the newspaper every day, and there's nothing else to do.
If it makes them happy.
But if that what makes them happy, but I think it's the unknown. It's
Yeah.
the fear of the unknown.
Yes.
Look, I mean, you've also made changes in your lifestyle,
Yeah.
you know, and I think if you don't do it by the time you're 60,
Yeah.
you may end up not having time to enjoy your retirement because there's not enough years left. We all have to face
True.
that.
Well, Jeff has got a very nice yacht in Perth, and I go there and sail with him. Beautiful time. I was there, March? Is it?
Much.
Yeah, I really had a good time. I really appreciate him taking
Welcome.
care of me.
Yeah, welcome.
And with that, we have come to an end. So don't forget to keep it real from Azanoa. Thank you very much.
Thank you. Thanks, Ezra.
That was an adventure? Huh? I thought, oh shit, I was on the ground, like, it was flapping on my head.